Hello and welcome to Triple F, where flawed is the new sexy. These posts contain the use of obscene words and images, but note, it is strictly educational. Therefore, listeners and viewers' discretion is highly advised. On the 12th of January at precisely 4:40 p.m., I put up a post on my Facebook status with the caption, "Loose vagina versus tight vagina. Please share your experiences." The engagement I got from that post was really impressive, ranging from those that were perverse to the ignorant to the self-righteous, but most importantly, those who contributed and shared their experiences. So I really want to thank you guys, for without your contributions, this episode wouldn't have been possible. Now back to business. How do we deal with our loose or tight vagina? Are you aware that just like the penis, the vagina comes in different sizes? The size of my vagina is not the same as yours. So I'll be using this balloon to describe our vagina. The vagina is elastic, measuring about 2.5 to 6 inches in length, and has the ability to stretch to up to 200% to accommodate things going in like the erect penis or coming out like a baby's head. However, it will take long for your vagina to snap back to its previous shape after these activities. When a woman is aroused, her vagina self-lubricates in a process we call getting wet. The vaginal muscles also relax. This enables the vagina to lengthen in the process called tenting, or to expand in a process called ballooning. A similar but more profound process occurs during the delivery of a baby. On the contrary, when a woman is not turned on, she's uninterested, not physically ready, or she's anxious, her vagina contracts, and this causes it to not lubricate or expand or stretch. This is the key reason why rape is disastrous, because not only does it psychologically affect the woman, it can also cause physical damages to her vagina. So take note, if you did not just recently give birth, you're not approaching menopause, you didn't just recently undergo vaginal reconstruction, hear this loud and clear, your vagina cannot get loose. I hate to point fingers, but if having excluded all these possibilities and he still complains that your vagina is loose, then you probably are not the problem. Now, to all the men who complain that our vaginas are either too loose or too tight, I hope you know better now that one size does not fit all. You see, our ancestors came up with the term loose vagina to describe promiscuous women. However, a woman who was said to have multiple sexual encounters with her partner was never termed to have a loose vagina. So the truth is, it doesn't matter how many times you have sexual encounters or how long it lasts for, penetration can never cause your vagina to stretch out permanently or become loose. However, before you start dancing and screaming, "Who run the world, girls?" there are salient things you need to know about your vagina and the muscles that surround the base of your vagina. Trust me, I don't plan to bore you with medical jargons, but if you ever hope to give birth vaginally, or you have given birth vaginally before, or you even hope to get old someday, which I guess we all want to, you need to listen to this. Most of the perception about how tight a vagina is during sex is related to the pelvic muscles that surround the base of the vagina, and not necessarily how wide the vaginal canal is. A couple of years ago during my youth service, I had a friend who recently got married as a virgin, and if there was one thing she actually dreaded was having sex. Apparently, she, just like myself, had promised herself that she was not going to have any penile penetration before marriage and wanted to keep the deal sealed. However, she wished the deal remained sealed because the trauma she passed through during sex was unbearable. This made me wonder, would it have been less dramatic if she was the virgin prior to getting married? There is a condition called Vaginismus where a woman experiences extreme tightness and pain before or during sexual intercourse while inserting in a tampon or inserting a speculum during a pelvic examination. This is a treatable disorder using vaginal dilators, Kegel exercises, and counseling, and it affects 1 in 500 women. I hate to bring it to you, but a tight vagina may not necessarily be a good thing. Having said what is obtainable for the young and non-pregnant women, let us deal with what happens as you age and after childbirth. Over time, multiple childbirths can cause a stretch in your vaginal muscles with an accompanied weakened pelvic floor muscles. After your baby is born, you may feel a little looseness in your vagina, but that is completely normal. Your vagina should start to snap back a few days after giving birth, although it may not return back to its original shape. If you've had multiple childbirths, your vaginal muscles are more likely to lose its elasticity. When you turn 40 and approach menopause, you may notice some changes in your vagina's elasticity, and this is due to a reduction in your hormonal estrogen levels. This causes your vagina to become thinner, drier, less stretchy, and less elastic. How do you know if your pelvic floor muscles are weak from childbirth and aging? You begin to accidentally leak urine when you cough, laugh, or sneeze. You feel the constant need to pee. You have pain in your pelvic area, or you develop pain during sexual intercourse. If you're uncomfortable with this development, there are pelvic floor exercises that you can do to strengthen your pelvic floor muscles. The popular one known as Kegel exercise. This can be done before, during, or after pregnancy, and even as you age. These exercises cause a reinforcement of the pelvic floor muscles at the base of your vagina, causing you to feel the tightness you once had before. That will be all I can talk about for today. If you like this video, please hit the subscribe button and turn on your notification to get updates on my new posts. Remember to drop in your comments and experiences of what you've tried before that worked for you. Kindly like and share this video all across social media. Thank you for watching.